when you've just graduated and you're looking for a job, most of the time they'll require you to be interviewed before they give you that job, because you're not the only one looking for that job, and also they want to know you more before they hire you. So that's my life right now. And so I was trying to prepare myself by going through some of the tips on how you should prepare yourself before you go for an interview. And so I wanted to like tell you guys about some of the things I found out, because yeah, I know maybe some of you guys are preparing yourself to be interviewed. So what are some of the things that I found out that you should prepare yourself, like things that you should know before you get to that interview? Hello beautiful people, welcome back to another video. If you're new here, my name is Luisodur, and on this channel I talk about nursing. That is my nursing journey. I also give tips to nurses and nursing students. So if that is something you're interested in, make sure that you click on that subscribe button. So the first thing I'd like to talk about is make sure you check them out, like check the institution out. Make sure you know something about them. Like nowadays it's so easy, because most of these like hospitals, they have a Facebook page, they have Instagram account, they have a website, so it's so easy to check them out. So you can go and check something about them, because at times nowadays I see they even write like even the amount of salary that they pay people maybe in different departments. So you can go check that out, so that even if they ask you how much is your expected income, you can have a rough idea, because at times they usually use that to like knock some people out. Like try and check them out, check what are their values, what are their visions, what are the things they care about, what are the reviews, what are patients saying about that hospital. Like even if they ask you like how are you going to make a difference in this institution, you can be able to, you cannot make a difference in something you don't even have an idea about. So you can like, it is so easy to answer a question when you like have a rough idea about that place. So make sure you check out the institution you're going to apply to. And then the next thing is review the interview process. Like nowadays it's so easy, because you can just go and Google or check on YouTube like what are the kind of questions that you usually ask in a nursing interview, how should you answer it, what is the process, what should you consider, like the same thing I'm going through right now. Like you like review the interview process, you look at what you require, and you just be ready, like because some of the questions that are usually asked, like the questions they usually ask other people are the same questions you're going to be asked. Like some of the questions are usually the same, so it's better if you have a rough idea of even what you're going to say. And then the other thing is, when it's the day for the interview, you make sure you get there early, because at times you being like, let's say you go there like a minute early, and the moment you just start like this, they already called you in for the interview, so you're so confused, you even forgot to switch off your phone, you're so tired, you're so confused, you're still even gasping for air. So the moment you are not comfortable, you won't even be able to answer a question that was so easy. Even if they ask you about yourself, you won't even remember your name or something. So make sure you get there early, you be comfortable, you even have time to review the process again, you switch off your phone, you like feel so comfortable, you even try and familiarize with the place, you even go to the washroom, you meet the person there, you say hi, they tell you, oh, don't be scared, like you will end up feeling comfortable the first 30 minutes you're there. The other thing is that be friendly. Like just start by be friendly, because at times most of these hospitals, maybe let's say you're going to a private hospital, it is kind of small, and the people there, they know each other. Like the watchman knows the nurse knows the person who washes, so they know each other so well. So the way you react can really make a lot of difference, because let's say you got in, you never said hi to the watchman, you find a lady washing, and then you just pass by you with your dirty shoes, and then she looks at you, she just keeps quiet. When you get there, after you are like done with the interview, they'll get to talk. At times they'll get to talk, and then they'll be like, oh, that girl, I don't know, I was washing, she even never said hi, she did this and this and this. So be friendly with everyone there, because at times the people who are around that place can even affect you getting a job. This is something that I've heard from other people, like it really affected them getting a job because of how they reacted. So just be nice when you get there, dress nicely, don't put on jeans. They usually say jeans is not allowed, because I know we are used to putting on jeans, guilty, but that day just find something nice. Like someone like me, I usually don't imagine myself in a skirt, but at times when it reaches that kind of time, you can just bring your ego down and put on that skirt or put on that dress, and yeah, just get through with it. It's only one day, it won't like affect your entire life only because you have to put on something decent. Even if it's a trouser, it's something like it's presentable for an interview. I know you know what I say about how you're dressing in an interview, so make sure you prepare yourself in terms of being punctual in time and looking nice. Like, just look nice, make your hair so nice, like look nice, be presentable. And then the other thing is you should know how to answer questions. Like, when they ask you something, you should be honest, because at times, let's say you're getting from another job and you're fired, so you can be honest about the reason as to why you're fired and just like try and say it in a way that it doesn't really affect your working there, because at times you might say it in such a way that this person will say, you, the kind of person you are, we ain't hiring you. But just try and be honest, and then you try and najitetea kidogo. Then don't talk much. Like, when they ask you, there's some questions that when they ask you, don't be so comfortable. I know you're supposed to relax and be comfortable, but don't be so comfortable, because let me give an example. They might ask you, you're married? Yeah. How many kids do you have? So instead of talking so much, just say, I have 2 kids. Like, they haven't asked you about all the details, because at times you might be so comfortable and you're like, I have 2 kids. The firstborn really gave me a lot of problem. I had to go through CS. Nowadays I still feel the pains in my stomach. My second child gives me a lot of problem. Even yesterday I took her to school. But don't say too much. Like, just be brief. Like, if they haven't asked you, like, tell us more about that, but you can just try and be brief, like, know how to answer questions. Yeah. And then the other thing, make sure that you have like at least 3 things that you're going to always use when answering these questions, because you find that at times a question may be like thrown to you and you're like, how am I going to answer that? So when you have like 3 things, let's say you have, like, for me, I usually say I have team player, and I have patient care, and I have learner. So team player, good at patient care, and I'm ready to learn. So when they ask you, why should we hire you? So you can always add in, like, because I'm someone who is a team player. So you use those 3 words, but you try and twist them in such a way that they fit the question. You're a team player, you're ready to care for patients, you're a person who is dedicated to care for patients, and you're a person who is ready to learn in work under pressure. You add all the other ones, but you have like some things that you always know, you can put them all, like, all the answer, so that it can at least flow. And then they ask you, like, tell us the things that you really value as a nurse. Like, I value when people work as a team. I value people who really like put themselves into patient care. I love people who are ready to learn. So you see, you are like using the same things, but you're kind of twisting them so that they can fit the question, because at times you are literally so blank. Like, they ask you this question so repeatedly and usually so blank. They ask you, like, because you will be having students, how are you going to influence these students? You're going to teach them, like, you're going to help them learn because they came here to learn. You're going to help them learn. You're going to teach them about the patient care skills, and you're going to teach them on how to work together. You use the same thing: patient care, learner, and team player. So you just have like some of, like, even 5 things that you can just twist around and answer questions. Like, it would make you feel so relaxed, because you can't be there, what can I do? Like, you cannot be so just try and have like a couple of words in your head that you can always be, because some of these questions, when you fit this answer, they just flow. Like, at times they don't want to see how right can you answer these questions, but at times they usually want to see like your confidence, and at times like how you believe in yourself. Like, at times those are the things they're testing. They're not testing on how right answers you're giving, if you're getting. And then also, when you are reviewing the questions, just try and know like what are the kind of questions they ask. Something like when they ask you about like your salary range, like, this is something that you should have already like looked for. You should have already like asked, and just try and like review from even your previous job, so that at least you have the answer. And also, when you're answering such kind of a question, don't be so rigid, like, oh, my expected salary is 40,000, and you're just like, that's it for you. It is just 40,000, and you're done with that. So don't be rigid, because at times you find that they're not even paying the other employees 40,000. So you say, my salary expectation is 40,000, but I'm open to any negotiation according to your values and the way you pay people here. So they know that they're kind of a person who is like, don't just be rigid. My salary is 40,000, you're stuck there. Like, you can say, because you want 40, you can say 50, and then you say you're ready for anything, so that they don't see like a person who is so demanding, like you're so demanding, if you get me. Like, if you want 50 40, just start by saying 50, and then you say, but I'm ready for any negotiation, and so that when they reduce it to the 40 that you wanted, and like it looks a little bit reasonable. Just go and check some of these questions, like they ask you like what is your goal, for the next couple of years or something. You tell them about yourself, like tell me about yourself. It is a question that almost most of every other interview person who is being interviewed is usually asked. Tell me about yourself. And then they should also usually ask something like the hardest thing you've ever experienced, because at times they usually want to know like what is your experience, what is the thing that you've experienced that is you consider hard. Because when they ask you the hardest thing you've ever experienced, you can say anything. Someone can even end up saying putting like inserting an IV is the hardest thing I've ever done. So they want to see like what do you consider the hardest thing, so that they can know to what extent can you really like push yourself. Like they usually ask this question to know like to what extent, if inserting an IV is what they consider a hard experience, then this person so they usually try and test such, they use such questions to try and test such kind of a thing. So another thing, why are you fit for this job? So the way I told you from the previous, having 3 things, having like 5 things that you can squeeze, like try and squeeze in, and because some of these questions usually just require kind of the same answer, so you know how to fix such kind of things. And then think something like what you'll bring and why you want to work for them. Like, why do you want to work for us? What is it that you'll bring into our company or into our institution? And then another thing they usually ask maybe something like, what is a mistake that you've done? So when they ask you a mistake that you've done, they usually want to see what kind of a person, are you? What are the mistakes that you can commonly do? Because they want to hire you and they want to know that you are not this person who will always be making mistakes and bringing problems to them. So at times you find that there was a mistake that you made maybe on your previous job or when you are still in like a nursing student, and this mistake was so big. So don't say like the big ones which can put you into trouble. There's something you can say, someone will be like, no, this person, if that is something that she did, this person, no. So just try and look for something like, let's say, there's this one time I was charting patients' notes, and then I wrote something wrong, and then I got into trouble. Like something that even if you do it on the in the institution, they can be able to forgive you. You see, you don't do something that if they picture you doing that in the institution, they'll have to fire you immediately again. So when they ask you like a mistake you've done, don't give the big mistakes. And then the other thing that I read was that when you're done, you should try and ask questions, like try and be someone who is interactive. Don't just show them where you are there. You only answer what you ask and you're just quiet, you're waiting. Like if you feel like the room is so quiet, try and ask questions. So the kind of question that I read about was something like, what is your nurse to patient ratio? Like they already feel like you are already interested in the job. Like you're already asking what is the nurse to patient ratio. You already asking them, when will you get back to me? Because they already feel like you've already even taken the job already. So you can ask them, when will they get back to you? How is the orientation usually like? And then you thank them. And then after thanking them for the interview, you tell them, I thank you for being able to interview me. I'm looking forward for your reply and what. Like, also don't be so quiet and just try and like show them like you care and you're really interested. At times people usually say that you can even get back to them. Like there's this person I was listening to, and she was saying you can try and even ask them like, after you've done with the interview and then like a day or 2 has passed, you can even write them an email and tell them that you are interviewed and you are still interested. Like that is something that I heard from a certain nurse interviewer, but I'm not really sure if it's convenient, because some people may take it like you are really so nagging and you are stressing them out, especially in Kenya. But for her, she was saying you can always get back, like after a day or something, you can always get back and be like, I was interviewed and I was looking forward. I was asking if I was shortlisted. If you're getting back and you're showing you're interested, that they may take you because they see you have a lot of interest. I know that might not work for every other institution, but maybe it might work for some. So yeah, it is also a thing. So yeah, those are the tips I had for you guys about preparing for your nursing interview. I hope it helped you guys, and whenever I'll have my own interview, I'll make sure that I tell you about some of the questions I was asked and my experience, so that maybe it can help you on your own experience. So yeah, that's it for this video. See you on my next video. Make sure that you subscribe and make sure that you like this video, and bye bye.